It's a pleasure to welcome you all to our public awareness program, Expert Talk on Current Management of MASLD and MASH. Our aim is to provide top-notch education and awareness about fatty liver disease to healthcare professionals, patients, and their families. So today we are honored to have Dr. Shubham Vatsya, renowned gastroenterologist from New Delhi, as a guest speaker. Sir, with more than 10 years of experience in the field, Sir is known to provide exceptional care to his patients for treating various gastrointestinal disorders, and his commitment to patient-centered care and spreading awareness about MASLD is truly commendable. So, without further delay, I would like to invite Dr. Shubham to share his valuable insights on management of MASLD. Over to you, sir.
A very good afternoon. Thank you for the kind words and the welcome. A very good afternoon to everyone. And today I'll be talking about the current management of MASH or MASLD. Uh, so next slide, please. So liver is the second largest organ, and it is located in the upper right side of the abdominal cavity, and it is soft in consistency and is highly vascular. Next slide, please. So there are a lot of functions of the liver, like it regulates blood composition, it processes nutrients, destroys RBCs, breakdown of alcohol and medications, controls 500 metabolic processes, produces proteins and cholesterol, and produces bile. Next slide, please. So, what is the main factor which leads to MASLD? It is being overweight or obese, having type 2 diabetes mellitus, or high cholesterol are associated with increased risk of MASLD. Next slide, please. So 1 out of 4 people have MSLD regardless of weight, and more than 6 uh, diabetics and 9 severe obese people out of 10 have MSLD. Next slide, please. So this is the natural history of MSLD. Healthy liver progresses to fatty liver, which progresses to liver fibrosis, and finally, if not treated, then leads to an irreversible stage of cirrhosis. Next slide, please. So fat accumulation in liver cells is also known as steatosis. Steatosis will lead to inflammation of the hepatic cells and is known as metabolic dysfunction associated steatohepatitis. Scarring of the liver in the benign stage is known as fibrosis. Next slide, please. So obesity, genetic background, food intake, physical inactivity, being exposed to certain medications, and metabolic syndrome are the predisposing factors of MSLD. Next slide, please. So being overweight or obese causes fat to accumulate in the liver. Obesity increases the amount of fat. So as it increases the amount of fat to constitute 5 to 10% of liver cells, it leads to MASH or and scarring of the liver. Next slide, please. So threefold increase in risk of death due to cirrhosis is seen in diabetes, and diabetes has an increased risk of MASH, and MASH has an increased risk of prevalence of diabetes. So there's 2.4-fold risk of developing diabetes in a patient with metabolic dysfunction associated steatotic liver disease. Next slide, please. So symptoms might include no symptoms to abdominal pain, loss of appetite, nausea, jaundice, confusion, weight loss, enlarged blood vessels, enlarged spleen, red palms, extreme fatigue. Next slide, please. So diagnosis of MSLD involves blood tests, ultrasound, liver biopsy, X-ray, CT, and MRI. Next slide, please. So most common blood tests are SGOT and PT. Persistently elevated ALT associated with disease progression. Patients with normal ALT can also develop progressive disease. Up to 80% of MSLD have normal ALT. No designated ALT cutoff for prediction of MASH or advanced fibrosis in MSLD patients. Next slide, please. So there are scoring methods which help us stage the disease. One is FIG4, which includes age, AST, ALT, and platelet count, and then is the NFS, NFLD fibrosis score, which includes age, AST, ALT, platelet count, BMI, and fasting glucose. Next slide, please. So non-invasive tests include ultrasound. Next slide, please. Fibroscan. Next slide, please. So the transient elastography, which measures CAP score and liver stiffness measurement. Next slide, please. So this is MRI PDFF. Again, a very good test and is gold standard for detection of fat content. Next slide, please. So liver biopsy is the gold standard method for diagnosing MSLD, only method to diagnose MASH and rule out progressive liver disease. It is painful and individual dependent, and chances of misdiagnosis in the early stage of MSLD are there. Next slide, please. So MSLD, isolated fatty liver with mild inflammation, MASH cirrhosis, HCCO. So progression happens if not treated with lifestyle modification and adequate medication. Next slide, please. So metabolic dysfunction-associated fatty liver disease, steatohepatitis is more serious form of MSLD in which you have scarring of the liver. MASH can lead to cirrhosis or liver cancer. Next slide, please. So diet, exercise, lifestyle modifications, and newer medications are the fourfold methods of treatment of NASH. Next slide, please. So combination of calorie deficit with moderate intensity exercise provide the likelihood of sustained weight loss. Weight loss at least 3 to 5% body weight helps improve steatosis. Weight loss 7 to 10% improve majority of histopathological features of MASH, including fibrosis. Next slide, please. So fibrosis, all stages show reversal with weight loss. Fibrosis needs more than 10%, NASH resolution for more than 7%, ballooning more than 5%, and steatosis more than 3%. Next slide, please. So Mediterranean diet, this is a very important uh, in treatment of MASH, and moderate portions, poultry, eggs, cheese, and yogurt. Every day, each meal should include vegetables, fruits, whole wheat grains, olive oil, beans, nuts, legumes, seeds, herbs, and spices. Next slide, please. Aerobic exercise reduces liver fat, maintains healthy weight, improves cardiovascular conditioning. Resistant exercises reduce liver inflammation, improves glucose absorption and insulin sensitivity, improves metabolic parameters with less energy consumption. Next slide, please. So lifestyle tips to tackle MSLD and MASH are you should get enough sleep, develop exercise routine and stick to it, get enough vitamins and minerals, regular medical checkups, eat small, frequent meals, and lower your sugar intake. Next slide, please. So pharmacologically, there are a good amount of molecules available. The three recommended molecules by NASL are pioglitazone, saroglitazar, and vitamin E. Next slide, please. So this is again the same thing. Next slide, please. So let's not be silent about the silent disease. Your liver could be still at risk even though you don't drink alcohol. Next slide, please. Thank you.
Thank you, sir. So now, sir, with your permission, I would like to hear your thoughts on few questions that we received from our audience. So the first question we received is how common MASLD and MASH in Indian population?
One in every four Indians has MASH or MSLE.
Oh. And so what is the ideal diet recommendation in MASLD patient?
Mediterranean diet, as told to you, so patient should have a hypocaloric diet. There should be calorie deficit. You should avoid sugar. You should avoid processed food. You should avoid uh, fried food. Black coffee is good for your health and for fatty liver and for MSLD. And we need persistent weight loss. So calorie deficit with high protein, high fiber diet and low simple carbohydrates. Next slide, please.
Yes, sir. Is fatty liver reversible disease?
With weight loss, it is reversible.
Okay. So on behalf of Nash 24 by 7, I extend my sincere thanks to Dr. Shubham for his enlightening and engaging talk on MASLD. Sir's insights have highlighted us the critical need for increasing awareness about fatty liver disease. I also want to express my appreciation to our audience for their participation. Your feedback and suggestions are essential for us. So please stay connected with Nash 24 by 7 on Facebook page for more updates and information. Take care, stay well. Thank you so much, sir, for joining us on today.
Thank you.